that checked right away. Don't wait a week, go immediately. Or if you have pain of any sort, you're not supposed to have pain when you see. You just open your eyes and you see. You have to worry about glaucoma. So it's important to make the diagnosis. Or if you have family history where everybody in your family, all the males in your family at age 40 lose their driver's license and can't see, you have to think that there might be an inherited condition that people should be evaluating you or a family member for. And for the inherited retinal diseases, there are some new treatments. People are trying vitamin A therapy, various eye drops and pills. The most common inherited retinal condition is called retinitis pigmentosa. It's rare, but it's the most common of those rare diseases, and some are discovered at birth and some are discovered later. So it's important to see an eye specialist so that they dilate the eye and see inside the eye, the inner lining of the eye, the retina, to see what's going on. And to prevent blindness, obviously, if you're playing sports that can involve injury, such as hockey, wear goggles or protective eyewear, or basketball. A lot of the professional basketball players do wear goggles. And various sports are really dangerous, such as lacrosse in the high school years, because the ball fits right into the socket and can really destroy the eye. Hockey puck injury to the eye can also destroy the eye. So then you would have reasons to, wear goggles and protect your eyes. Or if you only have one eye, wear glasses, because that needs lifelong protection.
Okay. So regarding the second site, how they're inputting electrodes into the back of the eye, so how does that really work? So is it like a surgery, a big surgery?
What happens, there have been studies now done at Harvard and also in Southern California, where they make a small incision, go back towards the back of the eye in patients who have lost their vision because of cancer, malignant melanoma, or they have no vision and there's no possibility of regaining vision, and they are recruited to see if they're interested in being in this study. And what happens, they implant the electrode right at the edge of the 10 layers of the retina, the retinal pigment epithelium. They put a very small chip there, and that computer chip gives them signals of when a light hits that chip, it interprets it and gives them some sort of vision. Whereas if you didn't have the chip and your retina is normal, the light hits, a photon of light hits, goes through the eye, hits the retina, and that retina, which is made out of 6 million rods and cones, sends an impulse all the way back to the brain, and it interprets it as light, shade, black, or, if it's a moving object or whatever. In a more sophisticated way, they can tell whether that light beam falling on an apple translates to the brain that it's an apple. So here with a chip, it's not so sophisticated. We can't say that it's an apple, but we can say that it's an object that's in front of you in your vision. So if you place an object here in front of the eye with a computer chip, you'll see that this object is either moving and it's changing the black and whiteness of the environment around it. So this is better than total blackness for these people. And these people are able to see black and white checkerboard patterns, which they could not see before. So this is the early stages. So we feel that, as ophthalmologists, that if we put a chip there, the more sophisticated chips that we can develop, so the light rays that come in here, they can send little signals to all the rest of the nerve pathways here and to form vision. It's the same principle as when we created prosthesis for Army veterans who had their limbs removed or blown up by bombs. What happens is that there are raw nerve endings there, and so they hook up electrodes there so that when they attach the new prosthesis, they can control these muscles and make that prosthesis move some of the actions that their hand would have moved. So it's very complex, because vision's more complex than just a striated muscle moving fingers. Vision involves color, size, shape, depth perception. So, but we're getting there. It's a very exciting time for this type of research.
Okay, so for this kind of in putting the electrode inside, does it matter if you're blind in one eye or if you're blind in both eyes? Is there criteria for that?
Now, I believe the protocol is for people who had destruction of their eyes, and it's usually one eye. And there are different protocols coming through, and there have been some people, the very first patients who submitted to the study, they were totally blind. And so those reports came out perhaps 5 years ago.
Okay. And so regarding Lucentis and Avastin, how successful are those injections for patients who are like 2200 or on blindness, almost blind?
Now, Avastin is called bevacizumab, and Lucentis is ranibizumab. And they're both monoclonal antibodies, and both made by Genentech. Originally, both were used for colon cancer, and we found that a very, very small amount, like 1 drop into the eye, was able to retard the growth of certain vascular endothelial growth factors that would cause bleeding. And what happens is that we inject right in here with a very small, tiny needle. Nobody feels it. It's done in the doctor's office and retina surgeons. And what happens is these monoclonal antibodies bond with the vascular endothelial growth factor like this, like an enzyme, lock and key, and prevent the action of the vascular endothelial growth factor. And then what happens, there is less bleeding over time. Usually it takes monthly injections for up to a year. You can sometimes wait it out and not go every month if there's extraordinarily good progress. And we've had patients who we've gotten from 2200 to 2020 within the space of 6 months to a year. So people know that, and they're excited, and they come back. They really know that it has helped their vision. This has occurred between from 2006 to now. So we've had a great deal of experience, all the retina surgeons across America. So people are very pleased with this. Now, one of the ways that people can test at home whether they have vision that they should worry about, because you said, how do you prevent blindness? Because obviously you don't suddenly become blind. There's only a few conditions that you can lose your vision suddenly, which is acute angle closure glaucoma, when you can lose your vision in 6 hours totally. That comes with pain, nausea, and vomiting, and loss of vision. And a retinal detachment, if you get hit in the head or you're very, very nearsighted, you can just wake up one day and your retina falls off. But those are 1 to 100,000. The incidence is very rare, or 10 in 100,000. So for the rest of us who were watching something's happening to our vision, it's important to test your vision with something called the AMD Grid, which is like a piece of graph paper. And this you can get at any ophthalmologist's office or optometrist's office. You can get it online, AMD Grid, or go on to my website, www.justforeyes.com. It's right there. So this, you cover one eye, look at the center dot. The center dot is just a round dot. And you'll see the lines should be up and down, 90 degrees. They shouldn't be wavy. Spots shouldn't be missing. Now, if you don't have an AMD Grid and you're right now at the home audience, you want to just check this out, you can cover one eye, go to the San Jose Mercury News or any newspaper, cover one eye, look straight at that newspaper. Are the lines straight? Are they wavy? Are you missing all the A's in the line? Or are you missing all the B's? Or are all the B's wavy or the T looks curvy? Then you have a problem. And you repeat that with the other eye, looking at the newspaper and see straight on if something's missing or wavy, or the whole line is missing. One eye sees the line and the other eye doesn't see the line, so something is wrong. Another way to test your vision is, you can test this all the time. You cover one eye, look at the color red. Both eyes should see the same color red. One eye should not see a light red and the other eye sees a dark red, because that means that you may have optic nerve disease, that this part of the eye is affected. This is the stalk that connects to the brain. And that happens in people who have bad nutrition, who drink a lot, smoke a lot. They can somehow damage this part of the optic nerve. It can come back. You have to see a doctor, get blood tests. So these are things to watch out for.
Okay, so regarding the AMD Grid, so when you see the wavy lines or the missing spot, is that due to a problem with the retina?
Usually this means it's a problem with the retina. It's very rare that's in the front of the eye. The front of the eye, let's say if you have a cataract and you want to know if you have a cataract, you can self-diagnose yourself. In a dark night, cover one eye, look at a street lamp. If the street lamp has halos or spokes coming out like the Statue of Liberty, that's a cataract. Okay. Now, in the sunlight, if you see that, that's your cornea. That means